Hi, welcome to Rogers TV's COVID-19 special programming. I'm David Shearman. Today our program will be talking about home and community support services. Now, that's a program we all know, and some of you may have even made use of home and community support services. But I have to say, in this time of COVID-19, and I've been fairly aware of what home and community support services has been doing, they have really taken off. My guests are Stephen Musehl, who's the Executive Director of Home and Community Support Services, and Carolyn Laitinen, who is one of the Program Directors, and we'll be hearing more about her specific responsibilities shortly. Steve and Carolyn, welcome. Good to have you here. And I guess, Steve, for you, you're back.
I am, yes. It's a pleasure to be back. I, like so many Grey County and Bruce County people, I went off to the city for school, and after a few years of working, I returned home for home and community supports, and it worked here for about 5 years before I was given a great chance to be executive director at the Alzheimer's Society. And then Andy Underwood, who everyone knows as the face of HCSS, decided to hang it up and enjoy retirement. So I was fortunate enough to come back to HCSS and take over his big shoes. So I'm really, really excited to be back. And this is my second week now without him. So we'll see if I can remember everything, but I think I'm doing okay.
So we could almost say you're now working without a net.
Yes, it's it was nice. I got a couple weeks to train with him, and I said, if we could ever have a system where we have two executive directors, it really makes things easy. But time for me to stand on my own. So I have a great team surrounding me, luckily.
That's true. And that includes Carolyn, who, and how long have you been with HCSS, Carolyn?
2 years.
Okay. And what's your specific responsibility at HCSS?
So I'm a programs director for the Meals on Wheels program, our Friendly Visiting program, and volunteer resources.
Now, there was an HCSS office up at the mall, which was kind of a storefront operation, walk in, but that's obviously with COVID-19 not operating. So where are you operating out of?
Well, I'm actually sitting in that office at the mall right now. So some of us are working at home and some of us are in the office. We're just not open to walk-in traffic.
Okay. All right. And you're working from home, I guess, too, Steve.
I am working from home today, same as Carolyn, to try to support public health. We are rotating in office and in home, so we have limited number of staff in office, but of course, as an essential service, we are allowed some to make sure people get paid for the work they're doing, and we're paying all of our meals vendors and other partners, and able to receive donations and other things such as that.
That's probably been one of the biggest shifts that we've seen in the COVID-19 pandemic, is that organizations which may have had a public front are shifting a bit and becoming maybe web-centric, but also in a program like yours where you are often referred. It has not made a difference. But what's the biggest difference that's happened with home and community support services?
I think from my point of view, we have a lot of in-person services with people with dementia or other cognitive disabilities. So we've really had to scale back some of our programming. Where normally our day-away programs would have 20 to 25 people in them, we've really only been able to have 2 to 5 people in them. So the burden on a lot of people looking after their loved ones in the home, unable to get the respite, that's been a big impact for our clients, for sure. On the flip side of things, Carolyn's seen a big increase in some of her support, so I'll let her chat about that.
Yeah, what's happening on the program delivery side?
Well, our Meals on Wheels program has been running since the very beginning of COVID. So we were able to take all of the public health mandates and train our volunteers and change our program so that we were able to continue to feed people. So it was wonderful in terms of being able to pivot and be creative in order to keep people being fed. So we haven't had a stall in our program since COVID What we did do is we centralized our frozen meal program. So normally we would have all of our day away sites have frozen meals delivered and our volunteers would meet there. What happened in COVID is we had to have everything centralized to our Owen Sound location. So now all of our frozen meals for all of Grey Bruce come here. So we have about 10 freezers in the back when we used to have 2. So that's been a big change for us. But the staff here have been wonderful with navigating the change, and our transportation department is helping us distribute the frozen meals to our volunteers to get them to our clients every month. So we've had some big changes, but they've been good changes. And we've also been able to partner with fellow agencies throughout COVID. So for instance, with frozen meals, we were able to receive some funding so that we could donate meals to the most vulnerable across Grey Bruce that we don't specifically have the reach to help. So fellow agencies like CMHA, Wyerton Salvation Army, Safe and Sound, United Way, local community groups, SOHAC, we've been able to work with them. So we were able to donate over 13,000 free frozen meals across Grey Bruce from March 2020 to April 2021.
Well, I know I've seen the numbers of meals in total that have been shared across or been served across Grey Bruce from all of the programs, and it numbers. Yeah. It's phenomenal. It's well into 6 figures now. It's unbelievable. But Meals on Wheels is a historic program. As I was saying before we started, I remember when it first started up, I think in Toronto, that, some of the very early days. Now, I was very young, so it's got a long and honorable history. But the fact that it can continue in the midst of something like this is quite remarkable.
Yes, it's been wonderful to watch. Our numbers have grown substantially. Like, for instance, even in January of 2021, our Owen Sound numbers for hot meals in January 2020 was around 250 a month, and this January it was over 550. So even in some of our areas that might receive more help than others, we're seeing a massive climb in our hot meal orders. Yeah.
Now, one of the other programs you mentioned is you're responsible for is the Friendly Visiting Program, I believe. How do you handle that in COVID?
Well, much to the volunteers' dismay, we had to stop the face-to-face and move to the telephone. But our volunteers, some have been asked, have asked us to put them on hold until COVID resumes, just because the social aspect is what they enjoy the most, which is absolutely fine. Other volunteers have decided that they really like the telephone visits, and they've taken on more clients because they don't find it as energy using as physically going to visit someone. So they can make a phone call at 10 in the morning and then make another phone call at 2 in the afternoon, and it doesn't take up as much time. So some of our volunteers have about 5 clients that they phone now, where they used to just visit one person. So like, for instance, last month we had 134 telephone calls out to isolated seniors, which has been great.
Well, that's a very interesting shift, because while the in-person visit has been sort of the keystone, circumstances have forced a change, and I presume both the visitors and the clients have accepted that.
Yes, there's definitely more acceptance now than April 2020. But people are patient, and they're being very patient and understanding with what we're able to offer, and keeping both sides safe, keeping the volunteers safe and the client safe. So we're lucky to have such an understanding group that we work with.
And it was great. We weren't sure, coming from the Alzheimer's Society, we did something very similar as well with the virtual support. We weren't sure how it would go, but some people that have never used a computer before became adept at Zoom and Skype and any other platforms, and they really, really took off. And for a lot of our caregivers now, they prefer it because they don't have to find respite for their loved ones. So really, it's opened up a new wave of or new opportunity to help support people.
That's a very good point, Steve. I think that if there is a change that has happened, it is that some of the technology has been, I don't like to use the word forced, but I suppose you could say that. We've been forced to adapt, to change, and I have, in my own work, I have to laugh. One of the seniors I work with actually was able to get onto Zoom without any assistance for the first time this week, and I went, "Yes, you are a pro." And she was as pleased as punch. So it's a good thing. It's one of those things that we have for change. Now, as we begin to move out of the pandemic situation, it's not over yet, of course. Do you anticipate going back to where things were using the same kind of technologies, or will you continue with both?
I think it's certainly going to be a hybrid model for a lot of things. A lot of our core supports certainly are in person, knowing that technology is going to play a key role. So, ideally our day away program is in person because that gives oftentimes a large portion of respite and activation for the clients. But there's certainly other programs. We've gone to a virtual day program as well, which some people really like. So can we continue that in some ways? The virtual phone calls and visits, in terms of a pure safety check, that's really great. And, that for a lot of people, that works better than in person. So, I think a lot of our services really are centric on being in person, but there's more opportunities than ever before with new technology. So trying to embrace them and figure out the best use of it.
Now, Carolyn, you referenced earlier that you were working with other services, other programs and services, and as we were saying before we started the program, if there's been a change that's happened or a strengthening that's happened here in Grey Bruce, it probably has to be that we are working better together, as the saying goes.
Yes, absolutely. It's funny you say that because the one thing that I've said throughout this entire year, and I know Steve's already heard me say it even in his month here, is that the best thing COVID has done for this organization is open us up to the idea of how we have to work together. We have to start working with other agencies and replicating programs, bringing them together so that we can start working as one. So it has started that, and there's a massive future going forward with the partners that we have already. It's been wonderful that way.
I was listening to a comment, and this is a true story, from one of the senior officials who I will not identify, who was at a provincial meeting, who actually a senior official here in Grey Bruce, who was at a provincial meeting and was queried about some of the things we were doing here in Grey Bruce. And, who gave you authority to do that? How can you do that with the parameters of the program? And the response was very simple. No one said no.
Mm-hmm.
And what it sounds like, and I've heard others doing program services say similar things, is this has really caused us to think out of the box and to look for partners and partnerships and potential partners, and to see what works, as opposed to sticking to guidelines and rules that may or may not be particularly relevant.
Exactly. We have to look at that small percentage that could work and go from there and just be innovative. And that's what we've been able to do this past year, which has been inspiring too, just to start new programs and just believe that, it's going to get better, and it is getting better.
Mm-hmm. Now, sorry, Steve, go ahead.
I was just going to say, to join in on that, virtual care is something I think we've been working on for years and years, and it's made a little progress, but the progress it made in 2 months because we had to was amazing. Right? It was well, we do this or we don't have another option. So from your primary care doctor to us at HCSS, we're able to get clients online, figure out the kinks as quick as possible, get us online, have people working from home. So the ability for staff and our clients to adapt and change and try to do a day away program over the internet was quite astounding and amazing. So kudos to our team for being able to do that, because change is hard, let alone something such magnitude to change to an online virtual support system. So they did really well with that for sure.
Yeah. I've heard it said in the medical profession that while it hasn't stopped the need for seeing a doctor physically, the provision of telephone or online care and having that conversation online as opposed to, or by phone as opposed to a physical encounter, has made medical care more efficient. Better use of time. And there's a downside, of course, but people are saying, hey, it's in fact, that reminds me, I haven't seen my doctor physically in about 2 years. So this is the way things will be. That doesn't mean you can't go up to the hospital and see a doctor if you're sick, or your own doctor might be able to can see you, but I think the same is probably true for you and your program. Where do you see things going, Steve, as we transition into a newer model of health from the LHIN to Ontario Health? We don't hear a lot about it, but it is coming. And do you see will there continue to be HCSS role in those programs?
Oh, definitely. I think, HCSS's role is so important. Our main role is to keep people safe and well in their homes and in their community. And that's really what people want. 96% of people, I believe, want to stay in their homes and communities as long as possible. So our programs are scientifically backed and designed to do just that. They're provide meals, provide housekeeping, day away and respite support, overnight support. These are the things that keep people in their homes. So I think, along with our other partners in the other sectors, home care is very important. Long-term care, of course, you need hospitals, really the backbone of the healthcare system. But I think now is the opportunity for community support services and home community support services in particular to expand and really show how important we are to the health system. So I think our role is only going to grow as people become more vocal that they want to live in their homes as long as possible and in their communities. So our role is to support that however we can. And certainly I see, working with our partners in all sectors from primary care to long-term care, it's a system. It's not a sector by sector base. So how can we work together to make sure it is one good system from start to finish?
Sure. Now, that idea of staying at home is certainly one that has priority, at least with the current government, and keeping people in their homes as long as possible. And of course, the program supports that. It's also cost effective, isn't it?
Yeah, there's been many studies that have shown keeping people in their homes with, an approach of many community support services as well as appropriate amount of home care is just, the same cost or cheaper than long-term care. So, if it's much preferable, people can stay as healthy. It really makes sense to invest in community support services more. And our past governments have invested really well in expanding our programs, but we need to keep doing that. Our wait lists continue to grow. As Carolyn mentioned earlier, we went from 50,000 meals delivered 2 years ago to I think it's 88,000 last year. So just exponential growth in our programs. Our day away wait lists were really long. So let's not have people wait for day away support or extra days of support. Let's have that so they can stay home, stay healthy. It's what people want, and we can do it really cost efficient and really well. We have such excellent team and excellent volunteers that it really makes it, in my opinion, the best option for a lot of clients where they shouldn't be in hospital if they don't need to be there and they don't want to be there. and they shouldn't be in long-term care if they're not, ready for that stage. Let's support people where they want to be and where we can support them most cost efficiently.
Well, which leads me to another question. What qualifications, or what kind of qualifications would an organization like HCSS be seeking? Let's say someone is in high school or is looking to change jobs. What kind of work, what kind of training would they need to work in programs that HCSS has? Now, I'm not talking about the volunteers. I'm talking about paid staff here.
Yeah, so we do depend on volunteers quite a bit. We, over 100,000 hours of volunteer service. So certainly that is an aspect that we could not survive without volunteers. But in terms of who we employ, we have a wide array of staff that we have. We have housekeeping staff, we have drivers, we have PSWs, recreationists, nurses. And then it's management, payroll, back office, administration, and really, in Grey Bruce, everything's needed. In healthcare, certainly the PSW and nurse shortage is wide and across Grey Bruce and Ontario, really. So we work on that. We try to make our programs really attractive. But nursing and PSW can be so rewarding, and our recreation staff make up our day away. So between those three, they really can support a lot of people, have a lot of fun in our day programs, and it's an exceptional experience if you've ever witnessed it.
Actually, I have. I have witnessed it, and I have to say the day away program, dare I say it, can be a whole lot of fun. It's a great program. But what I was thinking also, with here at Georgian College, they are opening up the new PSW program, as well as a new nursing program. So these would lead into perhaps employment with organizations like HCSS. And so that not only can you get training for in a valuable career, you can stay local.
Oh yeah, the options are unlimited, and we're actually pre-COVID, we were working as a collaborative long-term care and hospital and community to show students the different options, and we're going to present in school. So we hope that can happen again post-COVID or maybe in the new year. But really the options are unlimited, from supporting people in their homes or in their communities to long-term care and hospital, and there's lots of private business as well. So those degrees don't just lead to, oftentimes people think, well, if I'm a nurse, I go and I work in a hospital. There's an amazing amount of opportunities out there, and entrepreneurship as well. So really is a great program, and encourage people to, if they are interested, to learn more. And Georgian College, I know, has been great for us and other healthcare providers. They are an excellent partner at helping us find students and offering us support.
Sure, it's important to remember that, because we were talking just before we started that you, Steve, moved away and came back, which is very much a Grey Bruce common story. Dare I say it? Carolyn, I don't know about you, what your backstory is, but in people do move away, they do come home, and what you're saying is there are opportunities for work here, particularly as we deal with an aging population. This is, I guess if I were to say, if you have a service, it's going to expand. That these programs provided by HCSS are going to expand. They can't do anything but, given the needs that we've got coming forward.
Yeah, I think that's our future for sure. Andy and the senior management team and the day away staff and housekeepers, every employee's done such a great job at showing the value of our services. That's why people want to use it. It's so effective at helping keep people home. As I said earlier, everything is based on best practice. So really, I expect as our population ages, and I believe we are the third oldest community in Canada, so it will be a priority for Grey Bruce to support people living in their homes. The long-term care wait lists are growing, so we want to make sure they are great at what they do, but we want to make sure the appropriate people are taking those beds and not people that can still be at home living well.
And I have to say from my own work that having people able to stay at home and to have those services, I love the phrase wraparound services, really does make a difference, that people are far more comfortable in their own home where they feel familiar, they're surrounded by familiar things, and family is there. It makes a huge difference to their health and well-being. So I guess HCSS can only go from strength to strength, as the saying says.
Yeah, and that's something we've been able to do during COVID, is do wraparound bundled care, it's called. So people that are being discharged from the hospital with, whether it's a ER diversion or that was in acute care bed for a little while, we help bring them home, provide them meals, transportation, support with care planning, all the way around to, support with other agencies, a Home at Last program with VON, the Alzheimer's Society, support counselors. So we really partnered with the hospital and other community support agencies to provide that wraparound support, to provide people, safe at home so they don't go back into the hospital again.
Sure. I think that's both the future, both the present and the future. And I'm sure that I have a sense from both of you really enjoy your work. I'm sitting here, I'm watching you, Carolyn, I don't know, on the split screen here, and whenever Steve says, you're nodding, and that's you must like what you do. And Steve, you're obviously enthusiastic about these kinds of programs, and it's always good to see, because they are so important as we go forward out of COVID. That's a tremendous, and it's hard to say that, but it's true. The shots are coming, and we are beginning to move forward. So that's a wonderful thing to see. Now, we've got about a minute left. I was just going to say, there we go, just a minute. And I was going to say to the both of you that we wish you all the best as we move out of COVID. And if people want to contact HCSS, how can they do it, Steve?
We have our website, www.hcssgraybruce.com, or you can call our office, 519-372-2091. And there'll be a phone tree to help guide you depending on what you're looking for. So we're happy to hear from whoever.
Well, I want to thank the both of you for being a part of Rogers COVID-19 special programming today. Carolyn Laitinen and Steve Musehl, who of Home and Community Support Services. Great to have you both with us, and we'll hopefully see you again in other parts of our programming. Carolyn, Steve, thank you, and thank you, friends, for being a part of Rogers COVID-19 special programming. I'm David Shearman.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
Fun, casual, intimate, and personal chats with artists and creative folks in the LGBTQ plus community and friends, all on Season 7 of On the Couch.
Hello, I'm Liz Dowdsville, Lieutenant Governor of Ontario. In 2008, carbon monoxide, a deadly invisible gas, killed an entire family in our province. That tragedy